there's something happening at the back. Okay, is this my phone?
Yes.
Yes, excellent. So we'll just use that one. So, and thank you also for starting the day with a land acknowledgement. This is a really important process for all of us to engage with and to reflect on. When we think about our history of colonization in the province of Ontario, or what we now call Ontario, we can't avoid the fact that that has caused tremendous harm. And when we talk about youth mental health, child mental health, family mental health, we have to understand and reflect on the role that colonization, racism, anti-Indigenous racism has played in compromising the health of people across this country. And so I want people to think not just about today, but also to reflect on our past, where we've come from, and think about how we can continue to build a fantastic future together. This community is awesome. And part of what I want to do today is I'm going to go a little bit more in depth in terms of some of the issues that have already been discussed. I'm going to show you, hopefully, if I do a good job, show you how, by thinking differently, thinking outside the box, and listening to young people, we actually create solutions that have impact. So at the end, I'll circle back, hopefully if I remember, and ask you how I've done. And if I miss anything, please let me know. Okay, here we go. So, yes, excellent. I also want to say, actually, can you go back one slide? I want to acknowledge that I get to talk to you today. I got to talk to you about things that I'm super passionate about, but they're not my ideas. Some of them are my ideas. But this reflects the work and knowledge and wisdom of thousands of youth and family members and service providers and researchers, but we're kind of like off to the side. We have put our heads together over more than a decade to try and figure out some solutions. So while I get to stand up here and talk about it, you need to know that this is a reflection of lots of different people's contribution. Next slide. Okay, pre-pandemic, we were already in a state of mental health crisis. We all know this. Sometimes people don't fully appreciate the extent to which that was true. These were data that were released just after the start of the pandemic, and so reflect really not our within pandemic state, but in fact before. 1 in 3 Canadians have experienced abuse before their 15th birthday. 1 in 5 children in Canada live in poverty. And very sadly and shockingly, in that year, suicide became the leading cause of death for children aged 10 to 14. Just sit with that. Obviously, action was needed then, and action continues to be needed. Next slide. We're very fortunate here in the province of Ontario that we have the Ontario Student Drug Use and Health Survey. It's been running for 40 years, more than 40 years. The lead researcher, Dr. Robert Mann, sadly passed away recently. But through his efforts and his team's effort, Dr. Adloff ahead of him, we monitor the well-being of young people in school, grades 7 to 12, every other year, like I said, for decades. We can keep an eye on how they're doing. Now there are some limitations. It's only students who consent, parents can have to sign a consent form. It's only students who are in regular classrooms, lots of sort of limitations. In 2019, when the data were collected from the representative sample of students, it's about 15,000 students across the province, 1 in 6 students, that's estimated to be about 140,300 students indicated that they had seriously thought about suicide in the past year. They're shocking numbers. Next slide. And in terms of substance use, not only is adolescence a time when we see an emergence of mental health concerns and difficulties across different developmental tasks that arise during that time frame, we also have the emergence of substance use. Now, our most vulnerable young people may engage in substance use before adolescence. We're especially concerned about them. Once we move into adolescence, though, it is a critical period for the onset of substance use, and in early adulthood, the transition to problematic substance use occurs for some people. It's really in this age range that problematic substance use, and it's not all substance use, but certainly substance use that causes difficulties for young people can change the trajectory of their lives. And that's true for mental health concerns as well. When we do nothing during adolescence and young adulthood to address young people's mental health and substance use concerns, we leave them on developmental trajectories that aren't always optimal, and often really compromise their ability to engage and participate, have a sense of belonging, a sense of hope, and a sense of connection to a future. Next slide, please. And as Minister Tobolo highlighted, the vast majority of young people who could benefit from services, who are experiencing significant difficulties, don't actually ever receive services. And so this is highly problematic, and this is what we're trying to change. It says, there are 2 silos. I wish I could have lots more silos because the entire system is built in silos. And that's why we need to work together differently. That's why communities like this community are paving the way. The way you're all here in the room together today, the way you've come together to build the Grove and Youth Wellness Hubs Ontario, that's what we need more of. As the leadership this community is providing across the province, and actually not just across the province, but in fact across the country, and I'll talk a little bit more about that. But leadership also comes from young people. Next slide, please. Next, yes. So, I have learned the most of what I need to know from young people. This is a quote from a young person who participated in a focus group back in about, I think, 2014. My fantastic colleague, Gloria Heim, and I were doing this massive project across the country trying to build youth-serving tables of youth-serving agencies and implement a common screening tool. Some of it is the genesis of what we're talking about today. But what we did at the time that was innovative and interesting is we brought the results to youth in every community, and we asked them, what does this mean to you? What do we do with this? Of course, we found that there were high levels of need, that transition-age youth weren't having their needs met. It's really with talking to young people that we developed the solutions we've been implementing through Youth Wellness Hub Ontario and the Grove. So this young person said, seems so obvious, if there were more programs for people affected by trauma, like a mother's death, then there wouldn't be as many behavioral problems or substance use. So why don't we have those services? I think that's the question we're left with. Next slide. And so it is through innovation and disruption. It's through tackling these big, complicated, entrenched challenges that we can affect change. I'm 100% with Minister Tobolo in that if we continue to do things the same way, we will get the same result. We need to act and be different. And part of that, for us, was really about engaging with more young people, engaging with more family. And so we conducted a project, a study, where we talked to more than 400 young people across Ontario. We used all different methods because we wanted to reach as many young people as possible. We connected with community groups so that we would hear from young people whose voices are often not heard. It's one thing we have to be really careful about. Who are we hearing from? More importantly, who are we not hearing from? How do we ensure we hear from them? This is a word cloud. I'm gonna do that. I'm changing the slide. I'm looking at the slides, but I don't have control of them. I should have said that at the beginning. So we talked to more than 400 youth using different strategies and connecting with different community organizations. So we have a really wide range of perspectives. And we asked them, how does the service and system need to change in order to better meet your needs? This captures a little bit of what we heard. A real focus on collaboration, addressing practical challenges that young people face in being able to connect with services. And in this region, I'm sure you hear often about the challenges of transportation for young people, and really how they want services that are flexible, holistic, bring together different parts of the system into an integrated, collaborative care model. We also, next slide please, looked to what does the evidence say? We can't ignore that people ahead of us have also done fantastic work, and that has to be considered. When we think about evidence at the McCain Centre, at Youth Wellness Hubs Ontario, we think of it broadly. We think it comes from science, and it also comes from the expertise and wisdom of people who are living their lives, who are delivering service, who are experiencing difficulties. We did a scoping review to understand what we heard was some transformative work had happened internationally around improving access to healthcare for young people who, in low-resource settings, had sexual health concerns, other kinds of health concerns, by making services more youth-friendly. And so we did a scoping review to find out what that was about. Next slide, please. And across the scoping reviews, across the work we did with young people, we saw very similar issues come up. And then we worked with Youth Wellness Hubs Ontario. We started this idea of Youth Wellness Hubs Ontario, and we started to connect with young people across the province to hear from them and hear from family members what they would like to see in a new initiative called Youth Wellness Hubs Ontario. It's a little bit blurry here. We had a graphic artist who documented the kind of conversation, but you can see all of the different sort of major values that are reflected in the work of the Grove, Youth Wellness Hubs Ontario, and others. Next slide, please. I don't know if any of you recognize this image. This was in Maclean's in June 2020. I don't know if you remember, but we painted circles on the grass, and kids were told to play in those circles with their cohorted group. And at the time we were saying, I don't think this is going to play out too well in terms of mental health. And in fact it didn't. Next slide. So we've been very fortunate to be funded by our federal research funder to monitor. We were sort of had the capacity to do this because we already had lots of ongoing research through the McCain Centre. We were able to secure funding from Canadian Institutes of Health Research to monitor how young people did over time in terms of their mental health and other things. And so this is just kind of the first year of data. We're still collecting data. But I think the most important thing for you to notice is that when the pandemic started, we saw a peak increase in mental health related problems. And when things got better, it would drop down again, but it has not returned to baseline. And when we look at our data closely, it reflects both that young people who had pre-existing difficulties are by and large doing worse. Now there is no one story. We definitely have some young people who had some relief in the context, young people who experience bullying at school, young people who have different kinds of anxiety-related concerns where the pressure was off to do presentations or play your flute in front of the class. Some of those kids did a little bit better. But largely, young people who had pre-existing mental health concerns experienced some deterioration. And in addition to that, we have a whole swath of new young people experiencing difficulties they never had before. And so what this means is the pressure on the system, the pressure on young people, most importantly, their families, the service systems, is intensified. Next slide, please. We gather information, like I said before, we really want young people to have all different ways to share their perspectives. And so we also gathered information where young people could just write whatever they want. And what we noticed over time, so we're gathering information over time from the same group of young people from across Ontario. Half of them were young people who had sought services before, half had not sought services before, approximately. Initially, in the course of the pandemic, young people reported deteriorated mental health, increased anxiety, feeling unsettled, trying to figure out a path forward. When the pandemic, like the restrictions would loosen or it was summer and people could go outside, they felt like it was more back to normal, they could engage in social activity, less worried, accustomed to the context, accepting those challenges, and feeling like they have new insights into themselves. And I'll come back to that because a lot of resilience has been demonstrated over the course of the pandemic amongst young people. But as we've moved and continued to move through the pandemic, we've seen a little bit of a settling amongst young people into a lonelier state, into a state of feeling more isolated and bored and disconnected, experiencing school stress that's intensified compared to pre-pandemic, and more substance use for many young people. This makes sense because in fact our youth have had sort of the biggest, or the disruption to more aspects of their regular developmental course than any other age group. Over the course of adolescence into young adulthood, young people have an explosion of relationships that are outside of the home instead of inside of the home. They have developmental tasks like increasing their autonomy through getting their first job, getting their driver's license, through exploring career paths, through volunteering, through moving out of the house, through moving into post-secondary. All of these things were disrupted in the context of the pandemic. And so while their time is ticking, their developmental path became quite complicated and compromised. Now, next slide, please. It's not just about how challenging it's been, though. And I think this is especially where we have to listen and work with and understand the wisdom of young people. Because young people were also resilient. They also coped. And so what can we learn from them? Next slide. These are data from 2021, where we asked young people a year into the pandemic and the restrictions, what are some of the positive impacts of COVID-19 and its related restrictions? And so here you can see that 60% of young people said they had more time for their hobbies, more time with family, somewhat fewer, but still like half the youth said more time to self-reflect, work on themselves. They were spending less money and saving time from commuting. So more time, more opportunity to engage in things that they felt positive about. Next slide. When we looked in more detail, gathered a bit more detail, and you see a quote here. COVID-19 has made me more self-aware and grateful for what I have. It made me take things I have with more gratitude and makes me want to help others as well. So young people reported prioritizing their life path, focusing more time and effort on school or career path, creativity. They reported improved well-being, creating a better living environment, slowing down a bit, developing and using new coping strategies, spending time with their pets and in nature. In terms of social changes, the youth who participated in this study indicated they developed deeper connections, they removed toxic relationships. We hear about this a lot, how there was an opportunity to sort of, I don't know about you, maybe it's just me, but it's happened in my life as well, just have that opportunity to step away from some things that weren't so great for you. And that young people have done that as well. Reduced sense of the fear of missing out. And of course, now as we start to shift back to new normal, how is that changing? How are young people sort of reconnecting with that? And as I mentioned before, increased self-reflection and growth. Next slide, please. Our qualitative interviews, we used interviews as well. Young people talked about greater awareness of mental health and recognizing it as a priority, opportunity to foster mental health and resiliency. And the quote at the bottom, I guess it also taught me that even if I experience difficulties, I think I'll probably get through. And similar, so we just did our 11th round of data collection, and it's our last round of data collection. We communicated that to the young people who we've been engaged with over this entire time. And so on the survey, they had the opportunity to write whatever they want. So this young person wrote, "This survey has provided me with a space to reflect on my own experiences and has been somewhat therapeutic in a sense. I remember back at the peak of COVID, I filled out one of these surveys and it made me cry to think about how awful things have become. But now I'm much happier and it makes me feel grateful to be able to reflect on how far things have come." That's pretty much it. For the remainder, I want to talk to you about how far things have come. Youth face many challenges. We face many challenges. We want our youth to thrive. And by working together as a community, every member of the community has a role to play in helping youth to thrive. So I'm going to talk to you about what is Youth Wellness Hubs Ontario and how the work we are doing, which has been co-created by youth and families and service providers, is contributing to wellness in our communities, and a little bit about how much more work there is to do. So Youth Wellness Hubs Ontario is kind of this thing that refers to lots of different things. In part, it refers to services that happen through the Grove, through other service delivery platforms in communities across the province. But it also refers to kind of an infrastructure or a glue that holds us all together. And I want to talk to you today about this issue that Minister Tobolo raised about accountability. We need accountability to our young people. And if I had control of my slides, I'd flip by, but it's like way too hard to do it this way. But if you think of that image that the graphic artist did, it depicted what young people wanted from Youth Wellness Hubs Ontario. Oh, look at that. I don't know if you can see it here, but over in the corner there, next to core values, a commitment to evaluation and quality. Some people seem to think that asking the question, did the service we offer help? Did it do what it was supposed to do? That somehow that's not part of good service delivery. But I don't know, I get asked that everywhere I go. And young people actually told us we need to do that. They said, listen, we want to be able to go in there and ask the question, is this going to help? And someone should be able to answer that question. And answer it in a way that's based on knowing something. And so accountability to young people is critical in the work that we do. Thank you. So learning health system is kind of short form and I'll talk more about a learning health system as we go, but Youth Wellness Hubs Ontario is also a learning health system. It allows us to ask those tough questions, to see how we're doing, and to improve, and continuously improve. But first I'm going to tell you a little bit about Youth Wellness Hubs Ontario. Next slide, please. We have 22 government-funded Youth Wellness Hubs Ontario networks across the province. They include the last 8. There are spread across all different contexts, purposefully, to ensure that we are both providing services and we're learning all the time, trying to learn how do we do this work better. We know, so I used to talk, well maybe not this many, this is a lot of people in one room, but I used to talk to groups of young people, and I'm sorry if you've heard me say this before. Say to a group of young people, okay, if I take you up, and we did a road show, Northern Ontario, Southern Ontario, all over the place. I take you up in a helicopter and I drop you out of the helicopter anywhere in the province of Ontario with a parachute, of course. This is kind of what we do at the end of secondary for many young people. They go somewhere else. We say, where would you go if you wanted to get a coffee? Well, they say, oh, I go to Tim Hortons or McDonald's, Starbucks, Robin's Donuts, maybe for people that are outside of the city. Okay, so we take you anywhere, we drop you. You're feeling overwhelmed. You need support. You want to talk to someone. Where do you go? Where's the place in the community as a 17-year-old? Yeah, no common brand across the province, no easily recognizable place for adolescents and young adults to go, where they know that they have services that are purposely built for them. Big Blue H, yeah, we see high rates and increasingly high rates of presentation to emergency rooms for mental health concerns amongst youth. Where else could they go? Where else would they go? So we are trying to find that sweet spot. Minister Tabola mentioned it before. We need to be able to commit. Our vision is that every young person in the province of Ontario has the opportunity to readily and easily and quickly access high quality care. So we need some standardization. We need to be able to have a recognizable brand, and behind the door, we need services that meet the expectations of young people. Youth-friendly, holistic, integrated, effective. And we want those services to reflect the local community. We want to ensure that local youth feel like this is their place, that this has the look and feel of their communities that are in a particular geographic location. So we need to find that sweet spot. And so by implementing across a variety of different communities in Ontario, we have that opportunity as we grow to learn what does it take, what does it look like in a variety of different communities. And here in Guelph, the Grove, and across the region, Wellington, Guelph, we are learning about really specific pieces that are informing not just your local work, but our provincial work, and in fact our national work. Things like, how do we do a place-based initiative in a big geographic area? How do we address the needs of rural youth? How do we embed technology? How do we partner with post-secondary institutions to build better relationships amongst community and university? So that's what we're doing here, and in each community, we're learning something different. We're really seeing it as an opportunity to build out a system more generally. Next slide, please. So what is Youth Wellness Hubs Ontario practically? It is, and Minister Tabola mentioned this a little bit, so we have mental health and substance use services together with primary care, and together with education, employment, community, and other kinds of services. All of those things need to be together in an integrated model of service delivery. Young people say to us, like, I am not like in a bunch of different little bits. I'm just like me. I don't know if I'm having trouble at school or trouble with my friends or trouble with my family. That's not separate from my mental health. Is it the same? Is it different? Like, who knows? I want to be able to walk in the door and say, I need help. And the system, all of us back here, we work together to say, absolutely, how can we help? What are your goals? What do we need to do? And we figure out what are the services that need to be provided. And we need to work work together so we have consistent data across all of these services, so that we understand what young people need and how they're connecting to service. We also heard from young people, though, that it needs to be embedded in something that is broader. When young people talk about a life worth living, they don't talk about like mental health or physical health care. They talk about belonging and hope, and feeling like they're contributing, feeling like they're learning. And so things like time on the land, cooking classes, video game nights, social nights, where young people can get together, feel connected, learn skills, engage with one another, have a sense of moving towards a future. Those are critically important. And rightfully so. Many young people have faced racism, other kinds of stigma and prejudice within our systems. They deserve the opportunity to build a little bit of relationship with people before they start disclosing things to them. And by offering kind of an array of youth engaging activities co-designed by young people, we allow young people to find out what we're really about. Are we true to our values? Are we really open and welcoming? Are we really interested in providing culturally specific and culturally safe care? And through that, through engaging in our skills and well-being activities, young people have the opportunity to build those relationships and then move into more clinical skills once we've earned their trust. So it's critically important. Next slide, please. We have 6 core components. Youth engagement, you probably figured that out already because I've said youth co-creation so many times. But we co-create everything from the services. Young people are on hiring committees for the staff. They go out with real estate agents to pick the spaces. They have an ongoing advisory to help us figure out how to evaluate. They're involved in everything. And we have a family advisory as well, and an provincial Indigenous Youth and Family Advisory Circle as well. Integrated governance, this is a tricky thing. We kind of only can flow funds to sort of, in a particular way, but we want, the thing about Youth Wellness of Ontario is integrated governance. It's about making decisions together in the best interest of youth. So our old system, or the way our conventional system continues to work a little bit, sorry Minister Tobolo, block your ears maybe, is just like very much organizations are figuring out how their organization can be successful, and we lose sight of what it takes to support young people to be successful. So as part of Youth Wellness Hubs Ontario, what we try to do is really shift the focus. So organizations have to work together and focus on what's in the best interest of young people in order to be successful. So that integrated governance, it's not easy, but it's a core component of Youth Wellness Hubs. And then, as I've already mentioned, services need to be accessible. Young people can't wait. Like when you wait 8 months, 9 months, a year and a half, 2 years, when you're 13, 14, 15, you're in a completely different developmental stage by the time you get through the door. You can't wait. So our models need to operate on a walk-in model of service delivery, so young people can at least have an initial point of contact and some intervention right away. Next slide. Our core components also include culturally specific, culturally safe care, integrated service delivery. So it's not enough to be co-located. How are we actually providing seamless care to young people so they can move easily? And that's why it's essential that this is about system transformation. We work with existing services to deliver service differently, to work together differently. We're not building new services over here. We're working within existing organizations who come to the table and decide to work together differently. So core service providers, lead agencies in the mental health system, adult mental health organizations, substance use service providers, school boards, community health centers, everyone coming together to work together differently and deliver their services in a seamless way for young people. And importantly, measurement-based care, and I'm going to tell you a little bit more about that in a minute. Next slide. Equity is central to everything we do, not equity words, equity action. So we think about how do we embed kind of gives you a sense, though, of how at every kind of juncture we try to consider equity. Next slide, please. So what happens when communities like yourself, work together? Next slide. So, 63,675. I can tell you, this is the number of visits to 12 Youth Wellness Hubs Ontario centers over the course of the last 2 years, so over the course of the pandemic, including Wellington, Guelph, the Grove, as we've come online. Next slide. 19,611 of those visits were for services that are not our skills and well-being services, but are services that would include all of our clinical services, as well as those community and social support. So bringing together those data points that Minister Tobolo mentioned before. Next slide, please. 5,098. That's how many unique young people were served with clinical services within the hub and within hubs across the province, 12 that are part of this data that I'm able to show you today, and provided the information. So how are we doing on our goals? Next slide, please. Goal 1. We wanted to improve access and service engagement amongst young people. So don't forget, the majority of young people with significant mental health and substance use concerns, even before the pandemic, were not connecting to service. We wanted to fix that. Next slide. So you can see here the first line and the third line, the ones I've got circled, they add up to about 40%, 39%. 39% of young people, when they were asked, where would you have gone if you hadn't come to the hub today, indicated either they don't know where they would have gone, or they would have gone nowhere. So these are the young people we really wanted to reach. Of course, they've never connected to the system before, so it bumps up the volumes, and then that creates kind of like some challenges. We need to, and we've been very fortunate that we've worked in partnership with Minister Tobolo and the Ministry of Health to really acknowledge that and see that, because initially we didn't have staffing dollars really associated with operating hubs. But as our volumes increased, it became clear that we needed dedicated staffing, and so we were able to do that. You can also see here, hospital emergency room walk-in clinics, these other kinds of services, they generally range between 5 and 10% of youth report that in that moment, at that moment in time, they would have, otherwise if they hadn't had the hub, they would have gone to the hospital. And that, when you think about that across the province, those become quite large numbers. Next slide. Goal number 2. We haven't really talked about this very much, but we have previously, prior to Youth Wellness Hubs Ontario, largely, though not 100% true, and I definitely CMHA here has been different in their practice, but largely services were organized so that you served up to 18 or 18 and over. And culturally, the up to 18 services that were provided were very kind of family and youth-centered, very family-centered, youth-centered, and supportive, engaged with the school, all those kinds of things. And open, sort of trans-diagnostic, not heavily emphasizing diagnosis. And then at 18, you just kind of like fall off a cliff. And over 18, now CMHE here, honestly, I'm not just saying it because Helen's sitting here. You really have been like national leaders in working differently, but largely in the system, once you hit 18, families are less involved, a diagnosis is required, you have to be sort of at the more serious mental illness kind of in space in order to get the services. And so part of what we're trying to do with Youth Wellness Hubs Ontario 12 to 25 is to eliminate that age cliff. To really, we know that development, like, I don't know, how many of you don't answer this question, but like, there aren't a lot of 19-year-olds, 20-year-olds that are like out living completely independently and started, marching off into their lives. We have a longer period of development, and it happens to coincide with brain development, which also is longer than we once knew. And so it continues to the mid-20s, late 20s, that brain development around executive functioning and other kinds of important aspects of functioning continue. And yet our service models were like this other old weird thing. So, Youth Wellness Hubs Ontario, we're very committed to ensuring that the needs of transition-age youth are appropriately met with developmentally appropriate care. And so that was one of our goals. So you can see here, next slide. The circles are a little off, but anyways, you can see here that the majority of young people, over half of young people who are served through Youth Wellness Hubs Ontario are in that transition age youth range. So it really, lets us know that we're reaching that target audience. Next slide. So, of course, we're not just about meeting the needs of transition-age youth or meeting the needs of youth who have never been served before. We actually have to, we are a mental health and substance use related service. We actually have to think about what are the mental health needs, what are the substance use related needs. And so what you have here in front of you is a single item, but it's widely used. It helps us to connect to epidemiological data because it's widely used when we gather information about how people are doing. You can see here on this side, all right, this is the health-related data. So about 34% of young people report that their health, physical health, is fair or poor. When we look at their mental health, all right, when we look at their mental health, we ask them the same question. We see that 77% of young people indicate fair or poor mental health. So what that tells us is that the young people coming through the door are coming to the right place. They're not feeling great, by and large. But by contrasting these two numbers, it also tells us that, because sometimes adults are like, oh, kids, they're like so sensitive, they're just like whatever, they complain about everything. No, not true. They're not complaining about their physical health. It's very specific. It's their mental health concerns. Of course, we want to gather more information about that. What we hear from young people, like our sort of conventional system, our mainstream system is very diagnostically based. But what we hear from young people is it's about distress. It's about feeling like overwhelmed. And so we have that embedded in our evaluation system and our way of operating measurement-based care. We use all of the measures that we use inform the care that's provided to the individual youth. Then they're used by the hub to understand and guide their own development of services. Then they're rolled up and used at the provincial level to understand what's going on across the province. And ultimately, well actually even today, we then share that out with paid Canadian activities that are happening to help people understand the value of this model. And so what you can see here is like 90% of young people are reporting moderate to severe psychological distress. So again, we are not treating the worried well. These are young people coming in the door with high levels of distress. Similarly, in terms of depression, more than 2/3 of the young people who present for service have depression symptoms that are moderate to severe. And this is using the PHQ-9, which is a widely used measure across primary care and across our system. So it allows us to understand how our young people are doing relative to young people presenting for services in a variety of other contexts. And when we look at substance use related problems, now this is not any substance use. This is substance use where the young person is sharing with us that it's creating difficulties in their day-to-day life, that they're experiencing withdrawal, that it's compromising their goals, but they feel unable to change it. We see that 50% of young people presenting for service are experiencing significant difficulties with substance use related problems. So, that's a lot. Young people are coming in the door with lots of difficulties. So how do we respond? Well, we have no choice. We have to be a learning health system. We don't have all the tools we need in order to address all of the needs young people have, because in part, we're doing something new and innovative. It's the idea that we would work in a way that is transdiagnostic, that is co-created with young people, that is focused on accountability to young people, focused on continuous quality improvement, is new for mental health. And yet when we look at it, it's clearly optimal. The learning health system approach is an optimal approach. It's optimal for identifying and responding to emerging and changing needs. And it's optimal for delivering not only evidence-based practices, but these new practices that we need, which are evidence-generating. Next slide. We are very fortunate that learning health systems, though not widely used in mental health, have been widely used in other parts of the healthcare system. This image, which I really like, is from a group that runs the Healthy Debates group. They're funded through an intermediary by the Ministry of Health through the Ontario Sports Support Unit. And I like this depiction of a learning health system because it really captures it all. And it's kind of like, I don't know, I feel embarrassed disclosing this, but like when we started out, we didn't really pay attention to the learning health system, like about, I guess like 8 years ago, 8 to 10 years ago. But I'm sure glad we're kind of paying attention to it now because it has all of the core components of what we've done. So you use co-design, you understand what the challenges you're trying to tackle, you use co-design methodologies to develop a solution. You use implementation science to support implementation of the innovation. Implementation takes time. I don't know how many of you have made resolutions on January 1st, and by January 14th or January 31st, there's like just not happening. Our system is made up of people. Behavior change, practice change, all of that takes time. So people are embedded in structures and institutions that sometimes can be quite slow to change. And we're all subject to kind of like funding models and pressures and things that also are slow to change. So we need to use evidence-based approaches to support implementation. You got implementation, you evaluate, you make adjustments, you learn from what you've been doing, and then you do the whole thing all over again. And the reason I was nodding especially vigorously during your discussion of eating disorders is because here it is. So I think eating disorders in the context of COVID provides a really good example. So we started to hear, even anecdotally in media, young people are really struggling. I'm also a parent of two transition-age youth, struggling with body self-consciousness, body image-related issues, transitioning into eating-related issues in the context of COVID. So, is this a real phenomenon or is the media making it up? We can just, look at our data. So we looked at our data. These are data from April 20th, 2020 to present. We look at what did service providers report, the kinds of services, the kinds of, like their perspective on what need needed to be met and what they did. Over 16,000 of the needs that service providers reported on were nutrition and eating related. From April 2021, so just this past year, because this is our time frame, the meaningful time frame to speak to you about, 49% of youth indicated significant eating-related concerns in the past year. So then what do? As a learning health system, now we have our problem we need to tackle. We have data to help us understand the problem. We go to the experts. I'm not an expert in eating disorders. Who are the experts? What are they doing? What can they tell us? What do young people say? What do family members say? What are the resources we have? Then we can identify and partner with those experts, broadly defined, to develop a solution, and then implement a solution. And so we've implemented training across the province to support our clinicians in addressing this need, and we're initiated an adaptation of a UK model of early intervention for eating disorders. And as Minister Tabolo very rightly indicated, our conventional system has been entirely focused on acute care for eating-related concerns. We haven't had an early intervention model in the past. So here's our opportunity. And then we use implementation science to implement that new model of service delivery to address those current concerns that are now in our attention. And there are other examples too. So Youth Wellness Hubs Ontario as a learning health system makes it possible to systematically roll out, evaluate, adjust, and reevaluate all kinds of different new interventions, roll out. So in the past, and continuing in our conventional system, adolescent mental health, child mental health service providers have not had substance use really within their scope of practice or within the mandate of organizations. And it's kind of a legacy from this divided system we used to have. So we developed and rolled out basic substance use training for mental health professionals sitting within our children's mental health system. And now we're working on more advanced and, of course, co-created with service providers, youth and families. I promise I'll stop saying that at some point. We have evidence-based education and employment program that we've rolled out in 4 of our hubs. So that's another thing. We use a staged approach. So young people with mental health and substance use concerns who are not engaged in education or employment have particularly poor outcomes. Particularly poor outcomes not only in terms of their mental health and substance use, but their health outcomes and their employment and economic outcomes. And so as part of this model where we think of a young person as a whole person, and we think about how to support them to feel a sense of belonging and hope and connection and contribution and connection to meaningful activities, we've embedded an evidence-based employment support program and education support program focused specifically on how to work with employers to accommodate and understand, and how to work with youth to be successful. This is not the kind of program where we're lining kids up to be in the local fast food joint. This is really about finding meaningful employment and meaningful connection to the education system. And lastly, structured psychotherapies, which are essential for, I showed you our data on depression. I talked to you a little bit about the pre-pandemic concerns around suicide-related thinking. Those are not getting better, and in fact have gotten significantly worse. And so we need to ensure that in every community, young people have ready access to the structured psychotherapy kinds of activities and treatments that will support their recovery. So those are things like cognitive behavior therapy, dialectical behavior therapy, and family supports as well. Next slide, please. So what are the essential ingredients to changing youth outcomes? They're listed here. It really is an all-of-community approach. There isn't anyone in this room who can't contribute. It is about youth and family members, service providers, community leaders, politicians, business folks, donors, organizations, mental health, substance use, primary care, all of us coming together to think about how do we work differently to get better outcomes with and for our young people. And how do we co-design the solutions? How do we focus on the vision of every young person having access to high quality care in a timely fashion? It takes curiosity. It's really hard to wonder, are we actually doing what we set out to do? Are we achieving our outcomes? Are youth actually getting better? These are things that take curiosity and they take courage. We're really, when we have low resources and we compete for funding, it seems critically important to show your best side. But But as long as we continue to focus on that, we're going to miss what we need to do, which is to achieve better outcomes with and for young people. So we need the curiosity and the courage to take a hard look at how we're doing. And we need the commitment to stay the course and to believe in ourselves and to believe in our community when we find, oh, maybe that's actually not going exactly as we wanted. We need to change course. We need to stay committed to moving forward. And then we need to measure. And I know it's like ruffles some feathers, but we do need to measure. We need to measure using strategies that are comfortable for youth, that resonate with youth, that capture all different perspectives, and we need to measure. So that takes me back here to Wellington Guelph, your community, the leadership you've shown, the amazing work you've done in such a short period of time to get funds you needed, get people you needed, to engage with your youth leaders who are contributing their wisdom, and to not only deliver services in this community, but provide leadership across the province and across the country as well. So looking ahead, I've mentioned this kind of across the country thing a couple of times. So it's one of those funny things where at some point there was a tipping point. Initially there were really just 3 major initiatives that started in about 2013 to 2015. So FAMTRE, which is a BC-based initiative, province-wide integrated youth services. Access Open Minds, which is funded by the Canadian Institutes of Health Research and the Graham Beck Foundation, which was a research project, but also went way beyond what it needed to do and really built momentum around integrated youth services, and ourselves, Youth Wellness South Ontario. But now, actually 10 out of 10 provinces, and the 3 territories are still in discussion, but 10 out of 10 provincial governments have made a public commitment to integrated youth services. And so we have momentum. It's no longer just us working in isolation. In fact, we are working together to improve outcomes for young people across Canada. Next slide, please. So our next steps, the federal government has launched what they call IYS Net, or Integrated Youth Services Net. This is really a formalization of what we were doing informally, where we are all able to share information. And it goes a little bit further, because it really is about all of us collating our data across all of our separate initiatives to be able to answer big questions that we can't answer on our own. Some of those questions are deeply equity-based. When we look at how young people are distributed across the province of Ontario or distributed across Canada, we have young people in small communities all across this province or Canada as a whole that do not have within their hub many other people that are just like them. But when we look across communities, across Canada, who are implementing integrated youth services, we have an opportunity to better understand our impact for young people with different intersectional identities, experiencing different kinds of challenges. Communities in northern rural Ontario are more similar to communities in northern rural Manitoba than they are to Toronto. And so we need to be able to look across those. And as I said before, Wellington Guelph and the Grove and all of you have been the learnings from your experiences in terms of implementing the Grove in post-university context, thinking about how to better meet the needs of rural youth through partnership with existing organizations, and thinking about how we use technology are informing the work of this group across Canada. Next slide, please. So, passion led us here. You're all here today because you care. My challenge to you is to think about, where are you going to go next? What are you going to do? Who are you going to talk to? How are you going to contribute? Because everyone in this room has the potential to have that next great idea, to make that critical contribution, to help us move forward. Thank you.